Good afternoon, and thank you for joining us today. We're having our welcome to Christine Mason. She's going to be talking to us on respiratory services. She comes with 30 years of experience in the hospital as well as in the community setting. She currently has been working for Millennium Respiratory Services since 2012. Welcome, Christine, and thank you for joining us.
Thank you so much. I'm glad to be here. I will just start by saying this is my first presenting in Zoom format. I think the last time I presented anything was probably about 30 years ago. But a little bit of my, I'll just jump right in, a little bit of my bio. I started in respiratory therapy as a respiratory therapist at Bryn Mawr Hospital back in the 90s and worked primarily with pulmonary patients. And when I met and married my husband, I moved to New York and worked in pharmaceuticals for a few years. And then we had kids and I stayed home. So when I went back to work, which is, like Bob said, about 12 years ago, working with neuromuscular patients, it felt very much like a third career change, even though I had graduated and worked as a respiratory therapist right out of school. Working with neuromuscular patients is very different than working in a hospital with pulmonary patients. And what I want to discuss first is the experience of an ALS patient in the clinic and the work we do as respiratory therapists to manage ALS patients. And it starts at the clinic where, as my patients have shared with me, the clinic experience can be very overwhelming. So hopefully I can just provide a little extra clarification or information regarding the testing done. When you go to the clinic and you see the RT, breathing tests are done and questions are asked and we record some vitals. And the breathing tests that we do, I'm sure everyone remembers who have been there before, the big deep breath in and the exhale out. And there's a big deep breath in and a forced exhale. And then there is an inhale where you pull in against resistance. And these, in addition to the questions that we ask about sleep habits and daytime fatigue, if a patient experiences any times of shortness of breath or any issues with swallowing or choking. And we also record some vitals, respiratory rate and pulse oximeter, which I think after COVID, everybody knows what that is. And we listen to the breath sounds. And doing all this, whether you're a first-time patient and this is your initial assessment, what we're trying to do is see how effective the respiratory muscles are working. And if it is your first time, equipment or support, I should say, is not really, it's not necessarily going to be needed after that first visit. It could be. If you're an established patient, we still like to monitor to see if there's been any changes. And even if you do have respiratory therapy in the home, we still like to check in to see how that's working out. And just to clarify before I go any further, when I talk about respiratory therapy in neuromuscular patients, what I'm referring to is what we call DME, which is durable medical equipment. So just to reiterate, the whole point of going to the clinic and having time with the respiratory therapist is we're really, again, just trying to evaluate how well a patient is breathing and whether or not they may need some equipment in their home. I will probably end up repeating a few things, but I'm going to say for the first time here, it's really important that you keep up with regular visits to the clinic because it's really important that we monitor how you're performing and if there is support that's needed. So when we do, I talked about these breathing tests. When we do these tests and it's we're trying to assess what kind of support a patient may need, and the equipment we use, it's really four pieces of equipment. And from the most simple to the more complex, we have a neb compressor, a portable suction machine, a cough assist, and then non-invasive ventilation. Working again from the easiest to the more complex, if you're ever had a nebulizer, it's very common for asthmatics. It's a little compressor that connects to this handheld neb cup, and with a little bit of compressed air, it causes a mist and you breathe it in. So with neuromuscular patients, we can utilize this nebulizer with saline to help with thinning secretions, mucus. And the next less, I guess also easy machine would be the portable suction. And that's used primarily for oral suctioning for patients that maybe have excessive saliva, or if they do end up having a lot of phlegm or mucus to cough up, that can be helpful. The cough assist and the non-invasive ventilation are probably the most significant pieces of equipment. Typically, patients will start out with the cough assist machine. So referencing the testing that's done in clinic, if it's determined that a patient has a weak cough, an ineffective cough, meaning that it's not strong enough to clear their airway if they're congested, we recommend a cough assist machine. And I would say this is probably the most important thing at first regarding the benefit you get from not just clearing secretions, but also for lung expansion. If for those of you who are not familiar, it's not a super big machine. There's a few that are out there now, but it's set to give a big breath in and then immediately followed by an exhale breath out. That's like a suction. And what that does is mimics a cough. So when your muscles are not compromised, we all take a breath in before we cough out. And if your muscles are weakened, then this machine will do that for you. And it can be used with a mask or a mouthpiece. And like I said, it delivers a big deep breath in, followed by a suction breath out. It's been my experience with my patients, no matter how well I describe it, it's something that is easily understood once it's tried for the first time. So this machine is, like I said, important for removing secretions, but it's also important for lung expansion. And the better the lungs are expanded and the more open they are, the better your oxygen exchange is. So two really important things for this piece of equipment. The last piece that I'll talk about, the piece of equipment, is non-invasive ventilation. And this actually is more of a general term, and it can refer to two different types of equipment. It can refer to a BiPAP machine or a mechanical ventilator. So the test at the clinic, when you take that big deep breath in and you are able to exhale out, if you are not able to take in that larger breath, then you are not able to exhale enough CO2. And that's really what the problem is, that would have a patient require support, this non-invasive ventilation. Just to give a little understanding of the BiPAP machine versus a mechanical ventilator, both are similar in that they help support the patient's breathing, but they work in different ways. The BiPAP is actually an acronym for bilevel airway pressure. A patient on the inhale gets a pressure that goes into their lungs, and that helps expand their lungs. And then they exhale themselves, but on the exhale, the machine delivers a small amount of air back into their lungs, or I should say pressure into their lungs to keep their airways open. So it kind of does two things, but both will help with, number one, the lung expansion that the muscle weakness is preventing. The BiPAP can help and therefore assist the patient in exhaling the CO2. The end expiratory pressure can help with the oxygenation, the air exchange in the lungs once the patient gets the room air in. And a mechanical ventilator, we usually call it a ventilator or a vent, is a little bit more detailed, but basically does the same thing. It can do it in two different ways. I don't want to get too much into the weeds and get too confusing, but you can use a volume that can be set on that machine that can get delivered to the patient to help expand the lungs, or you can send in a pressure similar to a BiPAP machine, and that pressure will expand the lungs. Now, as far as how this can be used, there are several different masks is a very general term. You might hear of interface, but there are, if you're familiar with anyone that has BiPAP, maybe even CPAP, although that's a completely different modality, you can see different masks that people wear. But when a patient requires one of these machines, and it really depends on your DME provider, there's a lot of similarities, just like with ALS, there's a lot of similarities, but everybody is different. DME companies are the companies that provide this equipment. And there's some similarities, and then there's some differences as far as what equipment they use. So I'm trying to speak in a very general way. But if a non-invasive ventilator or ventilation is required, getting back to the interfaces or the masks that are used. And to give a little more detail, patients often ask me when it comes to this non-invasive ventilation, is this machine going to do the breathing for me? And whether you're referring to a BiPAP or a ventilator, the purpose for that machine is to not to breathe for you, but to breathe with you. What we're trying to do is add to the volume that you're already taking in. And again, just to be really repetitive, this lung expansion is so essential, yes, for the oxygen exchange, but more importantly for the CO2 exhale. So it's really a support, and like I said, to augment or add to the air that you're taking in. And typically, when this equipment is first introduced, whether it's a nebulizer or a suction machine, a cough assist, or a non-invasive ventilation, it's brought into the house by a DME provider, most likely an RT. And this person will, explain the machine and how it's used and what it's used for. And I would always recommend for anyone who is needing equipment to make sure whenever possible you have some support with you, another person just to help you hear the information, because it can be very overwhelming. And I would even add that to when you go to the clinic, to bring another person with you, because you get so much information and it can be really overwhelming. But when when equipment is needed and it is brought to your home, like I said, every place is different. Every provider of this equipment is different. It's essential to make sure you get a name and contact of this company in case you have questions or issues, or even if any changes are need to be made. But to back up to using the cough assist and the ventilator with both of these pieces of equipment, both take time to learn how to use. And I always tell my patients, you have to be patient with yourself, and make sure you have another person, whether it's a caregiver, a family member, a friend, or even a home health aide, that is also can become familiar with the equipment. So depending on the company, if you're not able to have a person with you at the time that the equipment is delivered and set up, you might need to reach out to that company to maybe have like a follow-up visit. But it's so helpful if you have another person with you that knows how to use this equipment. It's so important to be familiar with how to use it, what it's for, when to use it. And in addition to all that, it comes with the setup, the tubings, the mask, the filters, everything you need for this equipment to be up and running. If you have another person there, I feel like it's better and less overwhelming. And the more practice you get, the more comfortable you are with it. And the more comfortable other people are with it, the easier everything will flow. Often when I first meet new patients, they wonder whether or not they actually really need support. So again, when you're at the clinic and these tests are done and we feel that equipment is needed, there's a reason for that. And even if you don't feel it, even if you don't feel like you're having difficulty clearing your secretions, but the numbers that we obtain when we do these tests might show that it's something that you would benefit from. Or if you don't feel like you're having an issue during sleep, or you're not feeling tired during the day, but results show that might be something you would benefit from as far as the non-invasive ventilation, it's so much better to get the equipment into the home as soon as possible. What we really want to do with our ALS patients is keep them out of the hospital. And by familiarizing yourself with the equipment that you have and why you have it and how it works, and having hopefully caregivers with you that know the same, it can keep you healthier and again, avoid any emergency situations. What we want to do is, I guess I just want to speak a little bit more about being familiar with everything. You may not even realize that things have changed or that your body is responding any differently. But when asked the questions at the clinic, kind of jumping back to that, when we ask questions about sleep and daytime fatigue, what we're concerned about is the CO2 that I've mentioned so far about needing to exhale enough. And if you have too much CO2 in your body, it can be very problematic. And it's not always something that someone can be aware of. So using this non-invasive ventilation can help with that. So that's just an example of what I've feedback I've gotten from my patients that feel like they don't really need it. And pretty much the same with the cough assist, that I've gone to many people that don't feel necessarily like they have a problem clearing secretions, but they may just benefit from the lung expansion. And again, like talking about the CO2 buildup, we also want to keep the lungs open. The more your lungs are open, the better your oxygen exchange is going to be. And that's reflected in your oxygen saturation that we check. So I'm going to glance at my notes and make sure I didn't miss anything too significant. And just talking about going back to when the equipment comes into your home, and going back to the clinic, even if you're already an established patient and you already have this equipment at home, just to reiterate, it still is important to go to the clinic. When you meet with the RT, you may not necessarily do the same breathing tests, but it's a really good time to sort of express like how everything is working for you. If you do have, if you don't feel like you're getting the benefit you want from the machine and changes might need to be made, it's a good time to discuss it with the RT. Often the RT can get in contact with the DME company and either get an order needed if changes are to be had, and or set up an appointment with an RT to come to your house. And that also just reminded me of one important thing, that when it's determined that a patient may require equipment, require this DME, it's a bit of a process. It can take upwards of a week or two to get this equipment into your house. So that kind of also goes into the, it's better to start this sooner than not. And once you have the equipment in your house and you feel comfortable using it, and you feel like you have support and people that can help you with it, and again, like whatever caregiver means, whether it's family member or a friend or a home health aide, there is also, that's just what's important, is to just take care of this equipment and keep it clean, and make sure you check with your provider regarding changing supplies or changing out the tubing and filters. And once a patient is using everything relatively regularly, a few times a day for the cough assist, and hopefully at least 4 hours with the non-invasive ventilation, you want to stay on top of keeping everything clean and changing that tubing and filters on a monthly basis, and staying on top of your supplies, and paying attention to how you're feeling and the benefits that you're getting from it. If you feel like you're breathing better, most of my patients that I've dealt with directly, once they are using their equipment regularly, it seems to improve the quality of their day and their energy level. That has a lot to do with keeping your lungs open with the cough assist and clear, of course, and using the non-invasive ventilation for the 4+ hours. Ideally, we love to see all patients use it nocturnally, but that's a bit of an acclimation time. But most of my patients feel much better. It buys them energy throughout the day, and gives them more time to do what they would like to do. And I did just want to mention, kind of out of order, when I said being patient with yourself, it's a really good idea when you are first starting out using this non-invasive ventilation. The cough assist is a little bit different, but with the ventilation, giving yourself time to acclimate I have never set this non-invasive ventilation up on anyone who has put it on the first night that it was delivered and set up and slept all night with it. It's really important that you give yourself time to get used to it, and working with the RT to schedule increments of time and gradually building up. It takes a little of getting used to, but putting together a schedule that can get you to a certain time, wearing it a few hours during the day where you can transition to using it at night. And also regarding the cough assist, giving yourself, making sure you stay pretty scheduled with that after you've gotten used to how it works. And also just staying really good with that. That's more, I consider that more of like exercise with that deep breath. And it can also, though, with the cough assist, can obviously be used anytime needed to clear secretions. But that's pretty much what I wanted to talk about. I guess if I had to summarize everything, and like I said, I'm going to repeat myself, stay with regular visits to the clinic, do your best to get help, support when you have your equipment, and to really understand it and to be good about using it and to take care of it and keep it as clean as possible. And that's pretty much what I wanted to discuss today. And I guess if looks like I did okay with my time, so I can answer any questions that anybody might have.
Christine, we've got a few that have come in from the audience at this time. One was an early question. I think you've probably covered it, but maybe there's a way of just summarizing it a little briefly. What is the difference between a CPAP and a non-invasive ventilator? And I think you kind of, they jumped the gun. You did kind of explain the difference, and you went through even BiPAP.
That's okay. I am more than happy to re-explain it. In fact, every time I go to set up a new patient, I tell them that I will re-explain anything, but at every visit, I will happily re-explain whatever we've discussed. So the three modalities that we hear about are CPAP, BiPAP, and the mechanical ventilator. A CPAP is a completely different modality, not indicated for ALS. It is another acronym for continuous positive airway pressure. And this is what is used for sleep apnea patients. And it's worn with a full face mask. And what it is a continuous, just like we said, a continuous positive airway pressure. It's constant pressure that goes into the patient's airway to keep the airway open. It often gets tossed around like it's the same thing, but it is completely different from BiPAP and mechanical ventilation. Yeah, do you want me to? So it was, what's the difference between CPAP and BiPAP, right? So, I can re-explain the BiPAP just really quick. So I said with the CPAP, it's this continuous positive airway pressure that's meant to keep the airway open, where the bilevel is the inhale pressure is for ventilation, which is expanding the lungs and getting the CO2 exhaled. And the expiratory pressure is used for keeping those distal airways open. And so here we go. I know I'm getting wordy, but the BiPAP is, and the mechanical ventilator supports ventilation, where CPAP does not. And ALS patients need support with their ventilation.
Another question came in. Let's see. Will Millennium work with a hospice for a patient to get BiPAP or cough assist?
That's a great question. And Millennium is willing to work with any hospice program that is willing to work with us. So hospice programs are supported by the insurance company. And I know specifically with Medicare, and this is, I don't want to, this is not my purview, but I can share the information that I know about. So generally speaking, when a patient goes on hospice, they usually prefer to use their own providers. But if you're an established patient with another DME company, now since this person's asking specifically about Millennium, usually we can put them in contact, and if the hospice company is willing to work out a contract or payment for Millennium, we can keep the patient if they're willing to do that. So it's really, just to clarify, I want to make one point. It's really a hospice thing, not a Millennium thing. We're willing to work with any hospice that's willing to work with us, if that makes sense.
Usually with an initial assessment, the nurse will come out and assess the different medications, the different devices, and the different supports that this patient will need. She'll bring that back to the medical director for clearance prior to acceptance on hospice. So like Christine is saying, it's going to be more on the hospice end, and then they may have a direct vendor, or if they don't have it in that location, they may reach out to your vendor that's currently on board. Okay,
Yes.
but they many of them are more willing to try to keep people with the supportive technologies where possible. They just need to work with the best finances to get the equipment at the best price, because they're put on a capitation, a fixed rate per month for all-inclusive delivery of care. That means meds, nursing, other supportive care, and equipment. So definitely that nurse will be in touch with you if you're considering hospice, and then they'll work out the details with you directly after speaking to their medical director. Okay, if you have the equipment in your home, it runs on regular power. If there's a power outage, do they all come with battery backup? And if so, how long does the battery backup last?
That's another great question. So depending on the equipment that you have, for it, as far as the cough assists do not come with batteries. The newer ones, I'm not sure about the newer cough assist, the byways. I do know the T70 has a battery that can be purchased separately. The ventilators always have a battery backup, no matter what ventilator you're working with. However, if you're working with a BiPAP does not have a battery backup.
Yep. And we have two more questions that
Oh,
just
wait,
came
I'm sorry. To go
in. Right.
back, that person asked how long the battery lasts.
Right, how long do they expect
I'm
it?
so sorry. It depends on the ventilator and the type of battery. The newer vents provide longer power. Like I know the Astral ventilator I have, there's a lot of them out there. They have about an 8-hour battery. The older vents use either the older LTVs have a 5-hour battery pack, or a marine battery that's a 6 to 8 hours. The Trilogies and Evos have, I think it's about a 6-hour battery. Can vary a little bit depending on the settings and the age of the battery. So sorry about that.
It's okay. The question came in, when I use my BiPAP ventilator, I find that I have a lot of air blowing around my face. Is that typical of an indication of a problem?
My goodness, these are such great questions. So with any type of non-invasive ventilation, we always anticipate a leak. And there's a couple things that I would say, just to make sure your interface, whatever mask you're wearing, is fitted properly. We want it secure, but not super tight. It may depend on the amount of muscle weakness a patient has and the position that they are in when they are using it. The flatter a patient is, the more resistance they may have, and the air will find the path of least resistance. So it might be helpful if a patient is more upright if you find there's a lot of leaking. Again, this is, believe it or not, it sounds like an easy question to answer, but it's really not. It can get a little more technical than that. But I would check and make sure that your mask is fitting properly. The vent settings may need to be adjusted, and the position that you're in when you're using it. Side note, if you have a cough assist and you feel if this vent is meeting a lot of resistance, it might be a good idea to use your cough assist a little more frequently, because that can help keep your lungs expanded, which will help you receive that air from the ventilator or BiPAP a little better. So hopefully that helps.
Very good. Another question comes in as, my husband is having weakness breathing in with the cough assist. Would a nebulizer be recommended to help loosen mucus?
So that sounds like two different questions. So a saline nebulizer can be beneficial as far as loosening the secretions. But if a patient does not have a strong cough, it won't necessarily make it easier for them to clear the secretions. So if they're having difficulty, if I remember the question correctly, are they having difficulty using the cough assist with the inhale?
Yes, with the breathing in.
With the breathing in? Okay. There might be some adjustments that might need to be made on that cough assist, depending upon how high the settings are set. And then as far as, since I'm just going to answer, if it could be an adjustment on the cough assist, it could be the technique, depending on the settings that the cough assist is on. Some patients have to inhale to trigger it, but there's also an automatic setting that's easier if it's too difficult for the patient to initiate that breath in. So if that's the situation, you might need to reach out to the provider or the RT that you have contact with, and ask them to check what that is, if that helps.
Very good. And another question is, you didn't mention individual brands of ventilators, and you spoke of individual machines. What is your opinion of a Voxen?
Oh my goodness. Okay. So again, a really great question. Yes, I did not mention specific ventilators or BiPAP machines, because there's a lot of them out there. I think all of the ventilators are, it's kind of like a car, like every car will get you from A to B, but you might have a preference of which car you drive. I like the Voxen. I have patients that do very well on it. I am very hesitant to speak in this way of what's my favorite ventilator or what my preference is or what my view is on one. The Voxen is interesting because it's it encapsulates all the therapies within this one machine. So you can provide ventilation, you can provide a cough assist. It has a suction component, nebulizer component. So in that way, it's good. I think you can work with any machine as long as you understand it. It can be a little tricky sometimes. It might take a little extra brain power to learn to navigate between screens. And if yeah, so I like it. I like it enough. Like I said, I have patients that use it and do very well on it. It wouldn't, yes, I will leave it at that. If there's any more specific questions on it, I will ask that, but I like it enough. It just takes a little getting used to how to navigate between screens.
Very good. And another question comes in, is there equipment for someone without insurance?
That's a good question. Some companies may be willing to work with some level of charity, but I can't speak to that too much. I don't know much about that. But um, if you wanted to find more out about that, it would probably be a little bit of working on the phone, calling and asking places if, and I don't know if it's a matter of it, if it's a situation where the patient doesn't have insurance versus the patient would rather pay out of pocket. That would probably be, again, not my purview, but maybe reaching out to DME companies to see what they might offer in that way. But I don't really know too much about that. I'm sorry.
If you happen to have a vendor on board already, you might ask, do they have a loaner closet? If you don't have equipment at all, ask your clinic, who might they recommend has a loaner closet and what might their capacity be at this time. It will vary from time to time, what equipment might or may not be aboard, and then what are the recommendations for that vendor for helping you out with that.
Right. And
Okay,
actually, can I piggyback on
sure.
that too?
Mhm.
If there is, speaking about the DME that I just not other DME, just the respiratory. Um, Also, if you do reach out, find out to make sure that you can get support with that machine, even if it's from a loaner closet or a charity. Just making sure you have someone that you can check in with if you have questions or issues or problems. Thank you. Sorry about that.
And another question is, I get fatigued eating and after showering. Should I use my device prior or in conjunction with these activities? Am I possibly consuming too much oxygen on those activities?
So it's, I think when you say too much oxygen, you might be meaning, are you breathing too much? If you're finding that you are feeling short of breath doing certain activities, you referenced device. If you're talking about a cough assist or a non-invasive ventilation NIV, um, you could use, for example, let's just say showering. If showering is difficult, you can use your machine prior. If you know you're going to take 15 minutes to do washing up or whatever, you can use your machine up to that point. If you have a cough assist, you can even have that close by in between activities just to take a few inhales on. So it's also something you might want to address with at clinic or with your provider, because it could be a sign that you might need more support. But yes, you can use it up to and after. I have often recommended, I'm using the bathroom as an example, because people become out of breath after showering and dressing and everything. So you can have your equipment close by to use it right before and then have it ready right after if you need to just use it to catch your breath a little bit.
Okay, very good. And let's see, we have one more question. If a delivery of your device seems to be off, it seemed like it was very effective last week. This week it seems to be different. Uh, might you need to have maybe just a uh, tech come out and check, is your mask adequate or nasal plugs? Is there a delivery system that might be more effective than what was prior being used?
Um, Again, really great question. So when I was talking about being familiar with your machine and or your equipment and how it's used. You may find when you acclimate to either the cough assist or the NIV or both, that it doesn't feel, after a certain period of time, it maybe does not feel as effective. You may need some settings adjusted. It One of the things we try to do is monitor our patients. I mean, each DME company is a little bit different. So depending upon what company you're using, you may need to reach out and request a visit, because maybe it is a matter of the interface. It may be a matter of adjusting settings. I know with the ventilators, just by nature of the disease process, as patients weaken, we often need to maybe increase the settings a little bit to help meet the patient's demand. I'm assuming it's not a cough assist you're talking about, but the cough assist can kind of fall under that too, where you don't feel it is effective as it was when you initially started using it. But it's best to make contact with who provided you the equipment, and if an RT is available, definitely a home visit would be warranted.
Very good. And after you're an established patient, how often might you hear back from the vendor for a regular check-in, just to, I guess, checking in for, is everything all right? Is equipment working well? Any issues?
So again, that will vary from DME company to DME company. If I don't know, generally speaking, I think each company has different schedules. I usually, from my company, we usually do regular check-ins, like monthly or bi-monthly check-ins. Again, I feel like I'm giving the same answer. I would probably check in if you felt that something was different. I'm sure that the company explained this to you, but just going back to maintaining your equipment. All equipments have the cough assist and the NIV have filters. They have both filters for the air coming in and bacteria filters delivering, the air goes through to the patient through a bacteria filter. But you have inlet filters that you want to make sure are kept clean. And most of them I'll throw out some ventilators. The Astral, I mentioned the Voxen, the Trilogy, the Evo, they all have an air filter, and it will collect dust as it pulls in air. So make sure that's kept clean. And you can also keep an eye on the bacteria filters, because they will discolor after a while as they're filtering the air that's going to you. So they might appear like a little gray when they were white when they started. So that's also an indication that things may need to be changed. But that's two things you can do. But check in if you don't have a visit and you feel like something may need to be checked. Check in with that company about getting a tech or RT to come to the home.
Good. Two more questions we have separate. Should I feel different after using the NIV?
Hopefully. Again, like I'm getting repetitive. That's such a good question. These are such common questions that I get with my patients. Initially, when you're getting used to using the NIV, you may not feel anything right away. And when I said so many times during my talk that you have to, even if you don't feel like you need it or you're benefiting from it, to stick with it. Some patients feel a benefit right away, where they feel rested. If you're able to get your duration of time on the NIV up to a good few hours, 2, 3, 4 hours or longer. I have had patients tell me they feel more awake and they feel like they have a little more energy. And I don't think you mentioned the cough assist, but if this person's listening, the cough assist can also do that too. Giving you those big deep breaths can help get rid of that CO2, and that helps increase your energy. So you should feel some positive benefit after a few hours of using it for a while.
Very good. I have one more question. How long after eating should I wait before using my cough assist?
Oh, okay, good question. I would give yourself, so it's all about digestion. You don't want to force air in or have that suction out breath with a full belly. So I would probably give yourself at least an hour after. If you don't feel right after you do a few breaths and it's been an hour since you've eaten, give yourself a little more time, but at least an hour.
Good. And would the same apply for NIV or a BiPAP?
Not necessarily. I have had, I guess it depends on how used to it you are, but I have had patients that can use their NIV, not their BiPAP, but if they're on a ventilator, that are able to eat while on the vent. But that's after having been on the vent for a while. But that should not matter if you've acclimated. However, if you find that it does bother you and you're able to be off of it a little bit longer after you eat, then give yourself some extra time. It might also be effective to just eat smaller meals when possible if you feel like you need to be back on your machine sooner after eating.
Very good. I'm going to open if there are any additional questions before we close out. We're open to additional. Right now, I have no more questions in the chat box.
Okay.
Okay. Give them a minute to see if anybody types in. Any words of closure, Christine, as we close our session?
I would like to thank everybody for bearing with me. As I said, I'm not a presenter. I hope that some clarification was provided, whether it was with what I talked about or the questions. I wish I could be more available. These were really great questions. So I was happy to answer them, but thank you. Thank you, everybody. And I hope everyone's enjoyed the past day of and the rest of today as far as the other presentations.
Very good. And I want to extend our thanks to you. This session was very informative, very easy to follow. And I think we answered many questions that people had on their minds. I want to ask everyone to stand by. We have our next session at 3 p.m., which will be my ALS journey, thoughts, reflections, and unsolicited advice of healthcare providers and fellow patients. Speaker is AJ Sampat, medical doctor. Thank you for joining us today, and hope you join our next session. Again, be well and be safe.
Thank you.